without further ado, we'll kind of hand over to Anne-Marie or Jake.
Okay. Yeah, Jake. Good morning, everybody, and thank you for attending this. And I think it is like Joe said, that the number of different types of guidance that is coming out from government over the last few months has just been enormous. And please don't feel that you're on your own in being able to interpret that and or not being able to interpret that as the case may be, because we've struggled, you know, as professionals. I've got a whole team of health and safety officers, and some of the things that have come out, we've sort of had to have conversations about and struggled to understand what's needed of us as an organisation, and what, you know, what those little sort of smaller bits that are not that clear within the guidance really mean for the organisation. So what I've done today is, and please forgive me, I will try not to make it death by PowerPoint, and Will's going to guide the slides for me. And if I look away, that's because I've got some notes on another laptop that I just want to get over to you. So I'm not being rude and looking away at my phone or anything like that. I'm just looking at my notes. What I thought I'd do was try to explain the principles around risk assessment, hazard risk, the different terminology, and the terminology that's being used in terms of the COVID pandemic, because COVID-19 was something that we hadn't heard of 12 months ago, and suddenly, you know, that phrase now is ubiquitous, isn't it? Everybody knows COVID-19, and we mention it on a daily basis. So, as you know, just as a bit of background, it's a global pandemic, COVID-19. It's highly infectious and potentially dangerous. We know what the symptoms are, you know, and I'm not trying to tell you to suck eggs here. This is just as a little bit of a lead into what I'm going to be talking about in a few minutes. We know the symptoms: high temperature. So if you touch your head or your chest, your back, you feel hotter than usual, you might need to measure your temperature. Continuous cough, loss of taste or smell. The symptoms do vary, at least in the early stages. And some people have very mild symptoms or no symptoms at all, but could be actually carrying the virus. So this is why it's such a difficult thing to manage. Thank you. Next slide, please. I sound like the Professor Whitty, don't? And you know, next slide, please. When they're on TV and they give you those horrendous graphs that nobody understands. So, as I said, it's a new disease, and we're still finding out a lot about that disease. There's still so much we don't really know about it. You know, coronaviruses have been around a long time, but this is a new strain of it, and great news about the vaccine. You know, and hopefully we can get back to normal, and you guys can start doing your community, your very valuable community work that you do. It's currently believed that the virus spreads by attaching itself to droplets, and then enters the body through your mucous membranes, so your eyes, nose, mouth. So that's why it's really important that that hygiene is really paramount, and that people try not to touch their faces, eyes and mouths, which that's really difficult, because one of the things why I'm tying my hair back at the moment is because I've got this huge head of hair, which is really, really curly and goes in my face all the time. So I touch my face quite a lot. So I've been sort of making a conscious effort to tie it back at the moment, so I don't touch my face, particularly when I'm wearing my mask as well. And it is important that people that are showing symptoms are prevented from passing it on to others. So that's one of the really important control measures. And you know, that is something that you guys within your settings need to be mindful of. That if somebody does arrive to one of your events and they are, you know, showing symptoms, that they need to be sent away, which is a really difficult thing to do. If this is I understand that, you know, if this is a lifeline for somebody and they say, well, you know, I don't think I've got it, but, you know, I have got this slight cough, you know, you've got to be sort of really strong in saying, well, actually, you can't attend my session because, you know, I do think that you are you're showing symptoms. But as I say, it is possible to pass on the virus before any symptoms are showing. So that's why it's really important that we have those. other measures in place. Thank you. Next slide. Thank you. So you will have heard the phrase COVID secure. And so I think that's probably what you're all concerned about, is making your events or your sessions, whatever they may be, COVID secure. And it's how you do that, really. One of the things that the government are saying is work from home. Obviously, you can't do that. If you're delivering a art therapy class or a yoga session, you can't work from home. I think that, some exercise classes have been done online and quite successfully, but the whole point of going out to an exercise class, isn't it, is to have that bit of interaction as well with people. So it's not that easy to do. Carry out a COVID-19 risk assessment. Now, small organisations and voluntary organisations are being expected to do this without any training at all. And it's not an easy thing to do sometimes, to do a risk assessment. There's terminology involved in it that a lot of people don't understand. So I will go through that a little bit, and please don't feel you have to take notes on this, because I can share these slides with you, and Joe can send them out, or we can put them somewhere. So within the risk assessment, some of the control measures are the social distancing, that's staying 2 metres away. Where that can't be done, there are other things that the government are saying you can do. So putting other mitigation measures. So you see in supermarkets where they've got the perspex screens and things like that. So those are the other mitigation measures where you can't maintain that 2 metres distance. But reinforcing cleaning and hygiene processes is really, really important. Okay, next slide, thank you. So, just go back one, Will. I think we've skipped one. Okay, so just a few bits of terminology. So the hazard, and these two terms are always used interchangeably, hazard and risk, but the hazard is the thing that causes the harm. So in this case, it's COVID-19. And this is really difficult as a hazard, because if you're doing a risk assessment under ordinary circumstances, you can generally see the hazard. So it might be a trailing cable on the floor, you trip over it. So you can see that it's a hazard and you'll remove it, you'll eliminate that hazard. But with COVID-19, you can't see it. So that's why it's really, really difficult. And that's why the control measures are really, really important. The risk is the chance that that hazard will actually cause harm. So what we try to do when we do a risk assessment is look at the hazard, who it can harm, and then either eliminate that risk. But in this case, we're not going to be able to eliminate it because we don't know whether it's there or not. So that's the difficulty. So what you've got to do is reduce the chances of that hazard being realised as much as you can. So control measures, they're designed to eliminate, reduce or minimise the risk of damage or injury in a workplace or any setting, really. Has anybody got any questions on any of that so far? Please just shout up if you do.
No.
Okay. So if we just move on to the next slide. I won't go through this in too much detail, but there are categories of hazards, and this falls under the biological hazard, obviously, but there are physical hazards, safety hazards, ergonomics. So when you're sitting somewhere, people sitting at home at the moment, not having proper workspaces, there's lots of ergonomic hazards there for people. But in terms of COVID-19, this is it's a biological hazard, and they're often the most difficult to deal with. Thank you. Next slide. So the principles of risk assessment there is we identify the hazard, which we've done. The hazard is COVID-19, it's biological hazard. We've already said it's difficult because we can't see it, we don't know whether it's there or not. We decide who can be harmed, and in this case, anybody could be harmed by it, but there are some people that are more at risk than others. We know that younger people tend to recover from it relatively easily and quickly. Older people not so much, and there are ethnic and clinical considerations as well. So if you've got any clients that come into those categories, you might consider whether there's anything more that you need to do to keep them safe. Or, you know, you might have to make the difficult decision, well, actually, they are too much at risk here to attend my session. Again, really difficult decisions to make. You know, we're having to make those decisions with some of our work colleagues that do want to come into work, they want to do their normal job, but because they've been classed as quite clinically vulnerable, you know, we're having to say to them, well, you can't come into work at the moment. Evaluate the risk. So what are the chances of that hazard being realised? Well, again, that's really difficult to evaluate with something like COVID-19, because as I said, you don't know whether it's there or not. You don't know whether somebody is carrying it and not showing symptoms. But there are things that you can do. So that's where we need to decide on the control measures that you need to take. Record the findings. And what I've done is I've provided a little guidance document. I don't know if that's been passed on to you yet. And there is a template on there for you to record your findings, which I've tried to really, really simplify. Because you don't need a complex risk assessment with this. It can be fairly simple, and the simpler the better, really, because people will then read it, understand it. But you need to keep reviewing it. A risk assessment is a live document, so it needs to be reviewed on a pretty regular basis, and especially when new guidance from the government comes out, review the risk assessment and see whether any of that guidance has changed. So, for example, wearing face coverings in public spaces, that was one that changed a while ago. So that's when you would review your risk assessment to say, oh, actually, something's changed here. I need to look at that risk assessment and review it. Okay, thank you. Next slide, thank you. As I say, identify the hazards. So it's transmitted by people onto surfaces directly when they speak, breathe, sneeze, cough. That's when the greatest risk is if you're within 2 meters of an infected person. So that's where the control measures come in. So, you know, the separation, the hygiene, the face coverings, all those things are all control measures. The more people that you come into contact with, the more places that you go, the more crowded an area is, the higher the risk becomes. So that's when you can evaluate that the risk becomes higher. So if you can reduce your numbers within your sessions, if you normally have 30 people in a small space, then obviously you've got to look at that space that you've got and reduce your numbers down to ensure that you're not creating that risk factor. Thanks. Next slide. Thank you. Areas in the workplace or the premises that you need to pay particular attention to. So these are the areas, entrance areas. So when people are coming and going. So what we want is we want, if we can, one-way systems so that you're not passing people, you know, people coming in whilst people are going out. That's not, I know that that's not always going to be possible in some of the premises that you use, but, you know, staggered times, if you can do that, or give information to your clients beforehand to say, actually, you know, can you make sure that you don't all congregate at the entrance, you know, and when they're leaving as well, make sure that it's a controlled way that everybody leaves, so that they're not in close contact at entrances. Doors, so how they open and close, obviously handles on doors need to be cleaned more frequently because there are high touch points. Toilets and hand washing facilities, those need to be, you need to ensure that those are clean and that they are accessible, and that you've got plenty of hand washing facilities and hand drying facilities. Lifts and stairs, so buttons on lifts need cleaning more frequently, and handrails on stairs. I've put bedrooms and personal living spaces here because I'm probably going to present this to other people, so just ignore that one, obviously. Classrooms, office space, that kind of thing. Kitchen and food preparation areas as well. One thing that we're sort of looking at within the council is microwaves, fridge doors, that's things, you know, those sort of frequently touched areas within a kitchen, the kettle. So we've got wipes in there to make sure that when somebody's used those things, they can wipe them down. There's a lot of self-discipline involved in the control measures as well. People have to really be on board with it and have to follow. I don't want to say rules, but they are rules really, in what the way people have to behave. We've had to change our behaviour quite dramatically over the last few months. Meeting rooms, eating areas and other communal areas, those are high risk areas because that's where people would normally congregate, sit, have a chat. Did you watch Strictly the other night? Who's your favourite? That kind of thing. You know, but that can't happen. So communal areas really need to be cordoned off. If you do have tea breaks within your sessions, you know, you've got to try and discourage people getting together and having that chat. You know, it's great to have a tea break within your sessions, and please shout up and tell me what you do, because I don't know what any of your sessions are, so I might be talking absolute rubbish and you don't have time for a tea break. But if you do, you know, you've got to sort of try and discourage that socialising side of it, if you like. You know, the tea has just got to be for a refreshment rather than for everybody to sort of socialise. Hallways, passageways, they can be narrow, so when people are passing there, so we need to look at how we control that, and crowded outdoor areas as well. It is somewhat safer outdoors. We know that people can meet outdoors and it is somewhat safer, but still we don't want huge crowds congregating. So, you know, after your sessions, encourage people to leave and not congregate outside having a chat, which, you know, may happen under normal circumstances. Next slide, thank you. So when you're looking at the environment then and the people, when you're setting up your sessions, so are people facing each other? That's one of the risks. If you can have people facing away from each other, or, you know, sitting side by side, but with the appropriate distance in between them, that's the better way to do it. How many people do you come into contact with? This is for you as people that are delivering these sessions, you know, because you've got to think about you staying safe as well as the people that are attending your sessions. You need to keep them safe, but you need to be safe as well. So, you know, have an area marked out that you're not going to move from, you know, as teachers are doing in classrooms at the moment, to try and avoid coming into contact with people as closely than necessary. So do you come into contact with these members of the public service users? Yes, you will be doing, won't you? As I said, spacing the layout and having sufficient space in between the desks and tables, or the people, if it's an exercise session, you know, spacing people out appropriately. And how many people are there in the building, because it might not just be your session that's in there, there could be other people using the building as well. So, you know, you need to sort of address that and look at how many people are going to be coming and going at the same time, using the kitchen areas, using the toilets at the same time. For individuals, as I've spoken about, those that have pre-existing health conditions or risk factors, can we make reasonable adjustments to their personal circumstances so that they can still attend these sessions? Sometimes you might have to be ruthless and say, actually, no, we can't make enough adjustments for these people because they are such high risk. But there could be some that you can make adjustments for. Okay, thank you. Next slide. So as I said, those most at risk, those that are extremely clinically vulnerable, that may have had a letter to say that they should be shielding, they should be letting you know this and that they can't attend. And because there is obviously a lot of self-care involved with managing coronavirus as well. There are those people that are at moderate risk. We've spoken about older people. Those over 70 are particularly at risk. So I don't know what your cohort of clients, customers are, but you know, it's likely that you will have some that fall under these categories. Those in poorer health, and those with from certain ethnic backgrounds. You know, there's significant data now that says that Black and ethnic minority people are disproportionately affected by COVID. Yeah, those are all things we need to consider. We're not saying for 1 minute that we shouldn't have these people attending your courses, but it's just something to consider, that if you know anybody that is vulnerable is attending, then the hygiene and the measures that are in place have to be really, really secure. And I think I've got a couple more slides, and then I can take questions. Next slide, thank you. Yeah, so once you've identified the hazards and said you need to do everything that you possibly can to eliminate or reduce the likelihood of that hazard being realised, and that's with the control measures that we've discussed. Next slide, thank you. Some examples which I'll just go over again: strict hygiene and social distancing, reducing the numbers, organising the area in such a way. It could be that you need barriers. You know, we're looking at the moment, we're thinking about May when we do the mayoral and local election counting. We usually have 650 people in the ballroom, you know, counting. How are we going to do that in a socially distanced way? We need like 4 football pitches to be able to do it. So we're looking at perspex screens and PPE, that kind of thing, so that we don't have to have the same social distance, so but we can still continue the count. So that could be something that you might want to consider. Is there screening that I can use that will make this session that I'm delivering safe? And as I said, organising arrival and departure times, and providing information to the clients as well about the expectations. Tell them what behaviour is expected whilst they're attending the session, and to be quite clear about that they must follow these expectations. Thank you. Next slide. And again, I won't go through this in great detail because I'll let you read this at your leisure. But this is the hierarchy of control. So it's another sort of terminology that's used within health and safety and risk assessments. So the first thing we do is we try to eliminate the hazard. We can't do that in this case, as I said. If it was a chemical hazard, for example, you eliminate the hazard of a chemical by using a safer chemical. That's how you do that. But in this way, you can't do it unless everybody's working from home. Substitutes, so provide information online. If you can do your sessions online by Skype, then do it that way. Again, if you can't. Engineering controls, that's the screening that I've spoken about. Administrative controls in this case are things like your social distancing, and you're increasing the frequency of cleaning, and then personal protective equipment. Personal protective equipment, we always say, is a last resort, that you should do all these other things first. But in terms of COVID, then personal protective equipment isn't the last resort. For some roles, obviously our healthcare workers have to wear PPE. If you've got to get up within 2 meters of people, then what we're saying is PPE should be worn. And there is a difference between PPE and face coverings. So PPE, masks, might be fluid resistant, you might be wearing a face fit mask, which is fitted to your face, which it's like sealed onto your face, but a face covering is just what we all are expected to wear within public buildings and supermarkets, etc. And I think that's the last one. And I've already said this, that yes, review your risk assessments each time changes occur, because it is a live document. And that is the end. So that's kind of a very quick, very basic look at risk assessments. But for the purposes for you guys, I don't think it needs to be any more complicated than that. But obviously, the difficulty is applying those principles that I've just spoken about to the courses, sessions that you deliver. So, and obviously as well, evaluating the guidance that comes out from the government and trying to incorporate that within your risk assessments is probably the difficult part. Any questions on any of that?
Thanks, Anne-Marie. There's Christy.
Oh yes, a couple of hands
There's
up.
one in the chat as well when you're ready, but Christy's
All right, Christine.
Yeah, my question is I've heard a lot about ventilation, and the reason why I'm asking about that is that I do have a fairly large basement in the building that I work at that would lend itself really nicely for social distancing to allow groups in, but of course there's very, very little ventilation, and I wonder where that comes in with, do we leave the windows open all the time? What do we do about that?
Yeah, it's a really good question, and yeah, one of the control measures is getting some fresh air flowing through buildings. But obviously we're coming into the winter months. We're having this problem with schools actually, because we're saying to schools, ventilate your classrooms, but then we're getting complaints going, oh, the teachers are cold, the children are cold. Really difficult to learn as well and concentrate if you're cold. So what we're actually saying is ventilate before and after if you can, and try and keep a reasonable temperature. But we are talking about natural ventilation here, so opening windows, opening doors. If you've got an air conditioning system, whatever premises you're using, then that should be maintained, making sure that, so you speak to the landlord, whoever that is, making sure that that air conditioning system has been maintained in good order. So air conditioning is fine. There has been some stories about air conditioning spreading it, but there isn't any massive evidence of that, unless it's regurgitating the same air in a room. Then that could be an issue, but there hasn't been any huge evidence that air conditioning is a problem. But certainly natural ventilation is the best thing to do, and say if you can do it at the end, before and at the end of a session, and get the room well ventilated, but try and keep a comfortable temperature as well. Difficult to do, I know, and you're probably looking at me thinking, how do I do that? How do I keep my door, get my door up and then get it warmed up again? But certainly at the end of a session, I would ventilate the room, and try and have, if you do several sessions in an evening or a day, make sure that you've got plenty of time in between to do that sufficient venting of the room. Shaz.
Yeah, I work with a voluntary service called Headway South Manchester in Stockport, who support people with brain injury. Now, we rent a building with Stockport Homes for 2 hours once a week, but prior to us, we've got like children's breakfast clubs and different groups meeting beforehand. How physically is it to sort of do like a deep clean, or as much as a clean as you can do before our group meet? I mean, we obviously won't be meeting for a good while yet because they are vulnerable adults, but my main concern is we've just got a group of volunteers, and how we can sort of cover all them services, or is it going to be cleaners put into like these groups prior to us attending these sessions?
Yeah, what I would suggest, Shaz, is that you ask Stockport Homes that question. What cleaning measures have they put in place in between them, them renting it, because they do have a certain amount of responsibility to make sure that you're provided with a healthy, safe space that you're renting from them. So I would ask that question, that when there's a session in before us, what cleaning takes place, and check that those high touch points are cleaned. So like I've said, the door handles, the stair banisters, if there's anything like that, and really sort of emphasize that you want to know what the cleaning regime is. It doesn't have to be a deep clean. There is a lot of misconception around this about, oh, everywhere's got to be deep cleaned. If we have a case of COVID, we've got to do a deep clean. What the government are actually saying is, well, actually, normal cleaning's fine within schools. So we're not doing deep cleans in schools every time we get a case of COVID, because, as you know, we're getting them all the time. So we will be deep cleaning on a continual loop, I think. So, but normal cleaning with normal detergents and disinfectant, diluted bleach. Ignore all the stuff that you hear about health and safety as banned bleach. We have not banned bleach, and we have not banned ladders, just to get that out there. So bleach is fine, but certainly have that conversation with the people that you're renting the space from, and say, what are your measures? Ask to see their COVID secure risk assessment as well, because that should be detailed in it for that room.
Does
that help?
A quick question: the recording, how do we access that for the other members of the committee? The recording you're doing today and the PowerPoints, will they be forwarded on to us with a link at the end of the session, so I can share that with the committee?
We'll follow up with everyone that signed up, whether they attended or not, with a recording and the slide deck. So that's no problem.
Brilliant.
Okay.
Thank you. Thanks.
Sorry,
I was just going to respond actually to Shaz to say that I help to manage the Rose Walker Community Centre in Cheadle Heath. It's a council building, and what they've done in terms of cleaning is that they've said that whenever we have a group going in, which is very few at the moment, but we do have a few, then they have added an additional cleaning session every morning that there is a group in. But as part of the group's risk assessment, they have to agree to, as they enter, the leader cleans down all the touch points, and when they leave, they clean down all the touch points again. Yeah. So it's just that continuous list. But like you've said, that it's just normal cleaning, but we just make sure that the council has made sure that we have got additional wipes, additional sprays. So it's just on the side, and they just use it, and we have to trust that they will do that.
Yeah, thanks. That's really helpful. Yeah, it is a collective responsibility, like I said, and it's changing behaviours. You wouldn't normally go in, I wouldn't normally go into my Zumba class and think, right, I've got to wipe things down before I start my Zumba class. Not that I can do that at the moment, but it's what we're doing at the moment, isn't it? So it is a collective responsibility. John,
before I answer the question, I'll introduce myself. I'm the secretary and treasurer of Cheshire Crown Green Parks Bowling Association. So I represent 14 veterans clubs that play on the parks greens in Stockport. We're able to bowl at the moment because we're an organised sport following our national governing body guidance. So they've issued guidance to us. My question really is, since the opening of the greens from the 1st of July, the council have had the huts and toilet facilities closed. Our league season starts next April, and we would need those facilities and toilets to be open, as most of them, it is a veterans league, so I'd say the average age of those players is 70, and they're going to need those facilities. But are they going to be open?
John,
Can I make a comment there? John, have you spoken to your area committee about it? The reason I say that is we had this issue in Marple and we took it to the area committee and they reopened the toilets. So it might be worth speaking to, I know you mentioned that you cover a number of different areas. I think you said 14 across Stockport. It might be worth speaking to your local councillor and taking it to the area committees. I appreciate you cover a number of wards, but we took it to our area committee. So that's Marple, it covers Marple North and Marple South. And I mean, a number of groups obviously use the park there and they reopen the toilets and they've been reopened for some time.
Yes, I've been in contact with Jane Bardsley and
say Green Space, Jane Bardsley.
And the answer we got back was because they were multi-use, so I think the Greensmen use them, other small groups use them, that they couldn't maintain the cleanliness. Now, obviously, there's a cost associated with that, but for these leagues and for the well-being and mental and physical well-being of these players, you know, they've been stuck in since March. We need to get them out playing. And
John, let me take this away and speak to Jane Bardsley, because I have had the conversation with Jane and Peter Cook, who manages the green space now, and that was their argument about maintaining cleanliness. My argument was that I would rather people go in and have hand washing facilities than you know, having to use bushes or whatever. I was talking about children when we were talking about getting the playgrounds open for children, and there was an agreement that yes, it was better to have the toilets open even if they couldn't clean them every time somebody had used them, which is impossible. So let me take this away and have the discussion again with Green Space.
I know there's Sport England have got a grant system at the moment, where it's a start to start, if you like, what equipment you need. Now, whether the council can apply for that, I don't really know. Yeah,
I mean, I think, you know, the very least we can do is put hand sanitizers in the toilets and make sure that there is running water and hand soap. But you know, obviously what we can't do is go around every single public toilet that we've got.
That. It's just if the equipment is there to use, then we can use it.
Then you can use it. I'll take that away and speak to Green Space and see what the plans are. Did you say from April that is when the league starts again, John?
Usually, well, it's usually the Wednesday at the end of March going forward.
Leave that with me, and I will get your details off Joe. Do you so I can pass on the response? Okay.
If you're happy to share your email, John, then I will do with Anne-Marie.
No, that's fine.
Okay, great, thanks.
Everybody in the world's got it.
I bet they have, with all those clubs under your wing. Oh, fantastic what you do though, John, and not easy for people. And it's that balance, isn't it, between risk and people's mental health. It's really
well, yes. I mean, we've got winter. We've just been able to start winter bowling up again, but again we've got strict rules because we're in tier 3. But we can have 2 groups of 6, and the 2 groups don't intermingle with each other. And we have hand sanitizing stuff for the jacks and stuff like that. So I think we're controlling it pretty well, really.
And of course, you're elite athletes as well, so that's under.
Consider myself an elite athlete.
Right. Okay. Was there a question in the chat?
There is. Hannah's mentioned a couple of things here. So, Hannah, did you want to pick that up?
Yeah, that'd be great. Thank you. So, from Marple Sports Club, and I'd like to think we do really well in terms of COVID. So we have we cover 3 areas really. So we're a sports club primarily, so we cover all the requirements in terms of the sporting bodies, and then we're split into 3 areas. So we've got the sports side, trying to fathom all the guidance around there. We've got the community hall and all the guidance in relation to that. So today's been really helpful in that it's kind of confirmed that everything we're doing there is spot on with the risk assessments, etc. And then we've got the hospitality side with the bar and the function facility. And so what I picked out from today is in relation to particularly support groups that are running and the refreshment side. You've mentioned the refreshments, and obviously in terms of that, particularly a parent group that's running, they will all be sitting separately. They're all going to be, it's parents and babies, and they will be sitting socially distanced on mats. But for things like that with support groups, it's the opportunity to have a chat and have a drink that's so important to them, and is what brings people together. Are we all right with doing refreshments if it can be done in a socially distanced way?
Absolutely. There's nothing in the guidance that says you can't do that. What I was suggesting was that, you know, that people go, sometimes when you go to a club, you might wander into the kitchen and make yourself a drink. You know, I've been to cake decorating classes where we have a break and you go into the kitchen at Waltview House, make yourself a brew, get yourself a biscuit, and we all stand around and chat about how difficult it was to make a bear out of icing and things like that. But I think what you're saying is doing it in a controlled, safe way is absolutely fine, and I think that's a really useful tip. You know, those mats or, you know, those chairs that are socially distanced, because, you know, even at 2 meters you can still have a chat.
Absolutely.
And I do understand from a mental health, mental well-being, it's really important. It's a long time since I was a new mum, but yeah, definitely
it's just a lifeline for them, but I want to make sure we're doing it properly. You know, I'd hate to do it and then have to pull the plug on it. So just to be able to set it up and say to them, you know, this is brilliant, we can go ahead with this, and just to make sure it's right from the off, really. So that's great. Thank you. Thanks for that.
I'd just like to pick that up if I could. I work for the United Stockport Circuit, which involves 16 churches around Stockport. And of course, that drinking coffee and tea after a service is something that they've really been missing, the social aspect of church. Does that work in the same the advice that Tana just got? If we did social distancing, coffee and biscuits afterwards, would that be okay?
I think that's fine. There isn't, I will double check the guidance. I don't think there's anything in the guidance that says you can't do that, as long as, you know, as long as it's done in a safe way.
That's exciting.
This is what it's all about, isn't it? It's that behaviour, it's that social distancing, it's that hygiene, and it's that letting people know that they shouldn't be coming to these sessions if they're exhibiting any symptoms. And I think most people have got that now, haven't they? You know, that message has been drilled into us since March.
It's such a big part of it, isn't it? It's so
absolutely, I do absolutely get that. So I think if you can space the chairs out and still have that you know, that controlled way of doing it, and you know what we don't want is everybody congregating around a table, collecting their brews off that table, you know, using the same equipment. So you know, what if some, you know, one person can be in control of that and making sure that it's done in a controlled way, then absolutely fine. Wiping down the, you know, if it's a boiler geyser type thing, you know, wiping down that tap, making all the drinks, and then, you know, people come up one at a time to collect a drink from a table and then go back to their socially distanced area. It sounds really clinical, doesn't it? But, you know, hopefully this isn't going to be forever, and we can get back to normal. But at least if we can do something, it's better than running your session and saying, right, thank you everybody, off you go to your, you know, your individual homes, and don't speak to anybody, and, you know, don't gather on the way out, you know, because I sound really mean. Don't gather on the way out. Don't have a chat in the kitchen.
Is there limits on how many people can attend a church service, or?
There are for
Yeah.
funerals and
Yes.
weddings,
Depends on
but
the
I don't
space,
know.
doesn't it?
Yeah, no, I'm part
Yeah.
of St Matthew's Church, and I think it comes down to just how many socially distanced chairs you can put in the building.
Yeah.
We actually have
Yeah.
stopped our cafes and coffees afterwards, because we are just a church. There's no additional space. It's what you see is what you get. We've moved all the pews, and the vicar has literally done with a tape measure and masking tape on the floor, and it's like, don't move the chairs. Don't move the chairs, because we are, and we can fit 50 people now in our church, which is, it's a big Anglican church. It looks like a church got spire, but we can normally in ordinary times fit 200 people in that church, crammed, but to over 200 people. But yeah, I mean, in terms of funerals, weddings, there is limits, but for public worship, as long as you are socially distanced, you've got your mask and all the rest of it, and even the people at the front, they've got to wear the mask until they get up there, and then they can take the mask off, speak, put the mask back on, go and sit down. So it's all very, very controlled. We're kind of used to it now, and we've just started introducing communion in a very weird kind of way, but we don't share anything, but it is all doable within the guidance, as long as you really think it through and you've planned all your risks. Luckily we're Church of England, so they've been amazing. They've just thrown loads and loads of guidance at us and training, but we don't have after service coffee, because you can't sit and talk to people. So what we do is we go outside on the grass, take our masks off, we're in small groups, socially distanced, and as long as the weather's good, we can have a chat. And that's basically what we're doing.
And I think Pam's made some really good points there as well, that just reading the guidance, and most things are doable, but you just have to think them through carefully. But also there are other, so your governing bodies, your like you say, diocese, or Church of England, are also providing really useful advice. People like Unison and teachers unions, there is HSE, Health and Safety Executive, there is loads and loads of really sort of useful, positive advice out there as well of how to do things safely. So it's always worth just sort of Googling and just having a sort of quick check and say, is there anything out there for this this particular problem that I'm trying to resolve?
I'll put in our email address, our info@sector3, and if anything does change, or there's some nuances that you're not quite confident with, then please just drop us an email, and we'll revert back to Anne-Marie or Public Health, to get an answer for you. So don't feel that you're on your own in this. And sometimes, there is lots of guidance out there, but it is a matter of interpretation, isn't it? And having that confidence to do stuff. But it's really amazing that you are putting all the time and effort in to keep things moving, because, as you know, it's so important for our community. So I applaud you all just for keeping on going. It's great. Any more questions? I'll just pop my... And we're going to send out the, it sounds like you're all kind of au fait with the risk assessment process, and you're all doing that. But we will send out a document after this as well, which outlines that, and maybe that other groups that you work with or alongside might benefit from some of that information. It's a bit of a checklist for third sector organisations.
I think if nothing else, this has just sort of reinforced that you've done everything correctly, and that you have done your risk assessment correctly. So I hope it was useful in terms of that. If nothing else, if you haven't taken anything else away from today, you can say, well, actually, I know I'm doing everything I can possibly can. But I think also useful to sort of get insights from other groups talking to each other of what they've done and how they're managing particular things.
I have to say, I found this really positive, because there's a lot of doom and gloom out there, isn't there? And just to hear everyone talking about everything that they're doing, it's really positive, because isn't it great that we can all open and be doing things? And we've all had to make changes, but the fact that we're all doing this, and we're all doing it so that people can enjoy what they're used to enjoying, albeit in a slightly different way. We all seem to be wanting to do that and be open. The worst thing that we can do is be closed, in my opinion. And, you know, it's difficult. It's been so challenging, but I just get the impression that we're all trying to be open if we can. So thank you. I feel really uplifted being here today. Thank you so much.
Great. Thanks, Hannah.
Well, no one's ever said that about a risk assessment.
Maybe it's just me. I do risk assessments all the time. I'm sorry.
That's a great testimonial, Anne-Marie, for
Yeah, absolutely.
Probably get on very well, you and I, Anne-Marie.
bringing out the inner geek in people. It's great. Okay, anything else before we sign off? Because we're almost at time.
No, that's fine, thank you.
That's great. So we'll, like I say, we'll send out the follow-up information, and if you do have any questions, please feel free to drop info@sector3sk.org. I put a UK on the end, I didn't mean to, so that's our email address. All right, lovely to see you all, and take care, and hopefully you have a nice break at some point, because I'm sure you all need it, and we'll see you in the new year.
Thanks so much,
Thank you.
everyone.
Yeah.